Introduction to family support work. Introduction to the module. This module is intended as an introduction to family support work and all the duties and responsibilities that it holds. You will learn all the fundamental principles and functions that a family support worker must adhere to. Topics to be covered in this module. Definition of family support. Principles of family support. Functions of a family support worker. Duties and responsibilities of a family support worker. Daily activities of a family support worker. Key qualities of a family support worker. How to become a family support worker. Salary and working hours. Professional development. Career prospects. Definition of family support. Family support can be defined as a group of activities that display practical social networks. This is demonstrated through a combined number of programs. Such programs include voluntary, community and private services. There is a strong focus on the health and well-being of various individuals within families. Principles of family support. There are 10 principles often used when discussing family support. These can ensure the support worker provides the right care. Child-centered. This principle requires a strong focus on the feelings and safety of children. Needs-led. These are based on the needs of the family mainly. Strengths-based. This perspective considers the resilience of the lives of children and families. Socially inclusive. Aims to champion the social inclusion of all groups, including problems around disability, ethnicity, and different communities. Partnership-based. A crucial part of family support includes communities, professionals, families, and children. 6. Informal network focused. The perspective that the most useful methods are those which strengthen support networks. 7. Easily accessed. This principle claims family are meant to refer themselves, and multi-access referral paths will be facilitated. 8. Responsive and flexible. Family support, in this case, can include out-of-home care. Support is also flexible in time, location and more. 9. Collaborative in development. This principle promotes the involvement of external bodies, example service users in the planning, execution, and assessment of family support services. 10. Evidence-informed. The way success is measured using this principle is by facilitating evaluation focusing on the results service users produce. Services provided are based on best practices. Functions of a family support worker. The functions of a family support worker are as follows. Families with complex needs require focused, tailored help. The function of a family support worker is to provide this help. The aim of the help provided by the family support worker is to ensure any behaviors which could cause risks to children who are assessed and eradicated. The role also requires working together with parents and children to provide the best outcomes. At times, this may be outside of office hours, and an overall aim is to increase confidence in parenting abilities. Duties and responsibilities of a family support worker. There are several essential duties and responsibilities that a family support worker must uphold. These will include 1. Undertaking an initial assessment to identify the specific needs of one's family by the family support worker. Issues which can be prevented from escalating should be taken care of. 2. Carrying out caseload meetings regularly. This is another duty which can improve the role of a family support worker. These can be carried out with families, and new methods of improvement for the families could be discussed. 3. Cooperating and communicating with other healthcare professionals such as health and social care workers, colleagues and more. This will help with the handling of varying workloads. 4. Ensuring policies and practices are enforced, including working in line with safeguarding policies line with safeguarding, diversity, and inclusion. 5. Making sure to manage workload commitments as well as staying organized with meetings, admin, and appointments. 6. Assessing and evaluating parenting styles and providing practical assistance for parents who struggle when necessary. 7. Monitoring children who may require further assistance with learning and development, so family support workers should help them when needed. 8. Providing parents with tips and points on household management as well as budgeting. 9. Being prepared to stay with families during crucial times, such as a parent being in the hospital. 10. Assist in sensitive cases involving child protection and accompany families to court. Daily activities of a family support worker. The daily activities of a family support worker are aimed at improving the function and quality of life for targeted households. Those scheduled actions will include providing support and advice to families struggling, fulfilling recommendations set by social workers, encouraging parents during different parental duties, feeding and bathing the children, keeping in mind differing health and hygiene requirements, supporting families with children experiencing disabilities or those with behavioral difficulties, assisting with household maintenance, including budgeting and finances, providing support to parents until they are confident in carrying out specific tasks single-handedly, regularly performing checkups on families to ensure they are getting on well with the support provided by other workers. The key qualities of a family support worker. There are some qualities that a family support worker will need to possess to provide adequate care for families. These include good communication. Support workers must listen well and provide excellent communication. Building relationships. Building relationships with families will help ensure that their health and safety is being upheld. Remaining calm under pressure. Instances may occur where family support workers have to deal with challenging behavior. Good teamwork skills. Family support workers will often need to collaborate with several colleagues or industry professionals. This means that the ability to work well within a large team is required. Being empathetic, sensitive, and non-judgmental. Being able to sympathize and understand clients is a significant skill needed when handling families in crisis. The more sensitive a case is, the higher the risk of emotional trauma. Resilience. When dealing with traumatic situations, knowing how to cope is key. How to become a family support worker. There are several ways to reach the qualifications needed to become a family support worker. They include completing a college course and Level 3 Diploma in Health and Social Care, or a college course and Level 3 Diploma for Children and Young People's Workforce. 4 or 5 GCSEs are usually required for this at grades 9 to 4, a starter C. Taking on children, young people, and families practitioner apprenticeship. Similarly, 4 or 5 GCSEs are usually required for this at grades 9 to 4, a starter C. gaining training and experience through volunteering at appropriate facilities, nurseries, probation services, youth projects and more. Seeking direct experience working with youth, children, and families, as well as a Level 3 qualification in social work, childcare, education, counseling, and youth work. Salary and working hours. Salaries and wages for a family support worker will depend on varying factors such as location and responsibility. However, the job market suggests that starting salaries are between £18,000 to £24,000. Earning potential increases up to £35,000 with experience, particularly in a supervisory role. Those working as a central project and charity managers can earn up to £50,000. Working hours for full-time support workers is usually 37 hours a week. Other options such as part-time or casual and job share exist. Times can often be early mornings, evenings, and weekends to support families. Professional development. Continuous learning is required to improve the skills of a family support worker. Additional training can be taken in any of the following: safeguarding and child protection, first aid, equality and diversity, legal frameworks and procedures, signs of substance misuse and domestic violence. There are always opportunities for further development through study. You can also specialize in a particular area and gain postgraduate degrees. Career prospects. Various areas of work are available to experienced and qualified family support workers. These areas include working with people with disabilities, such as children with special needs and those with permanent mental and physical disabilities. Being a team leader, performing resource planning and employee engagement are much needed traits. Becoming manager of a family center or refuge, helping those in crisis and in need of support. Managing a support group. Move to other support work. Summary. During this module, you will have learned the following information about family support work. There are fundamentals, skills and abilities needed for family support work, and what is required to qualify as a family support worker. Many duties, responsibilities, and roles are essential to provide the right care for various families as a family support worker. There are also many principles of family support that need to be observed, as well as opportunities available upon qualifying for the work.